Please, our guests from all over the world, take advantage of our symposium that include educational, unique, and patient-based program. Participate actively to discuss challenges with you, peers, through our chat. Ask our world-class faculty some questions which will be the best experiences through our chat.
If you like our program,
first I would like to
please share the link with your peers, and they can connect and we can all participate. So let's bring other people to the conference, and let's begin the session.
Jan, what's going on? We're still in the studios. We're still, at home, watching our computers. Do you think it will change in the future?
Well, I recall last year we concluded the conference waving through Zoom to the participants, saying, "See you live next year in Warsaw." And look where we are. We're still on digital conference. Do you think it's really that bad?
Not so bad, because in the past we had to travel all over the world to join the congresses. Right now, probably in the future, we will have the hybrid conferences. Some people, they will stay at home. Some people will go to the conferences personally. But I think that some experience we had experienced last year, we will take for whole our life.
I think the notion of traveling across the world, flying to another continent to attend 2 dinners and 4 scientific sessions to learn 1 or 2 more little tricks how to do procedures, I think is ridiculous. So I think this is the way the world is changing. And I personally, I learned most of new techniques from Twitter or from conferences like this. So I think there is advantage to the medical world of this digital age, and I think especially there is advantage to the patients.
And also it is advantage for our young colleagues. You know, right now you can take 1 hour and see a few cases. You are able to learn so many tips and tricks. On the other hand, from the books, probably you are not able to learn. Even during the conferences, if you hear the speeches, also it's difficult. Right now, you are at home, you are taking the glass of wine, and you learn a lot. So it's a great for the young people.
Well, I agree, and I think the world has shrank through the pandemic, through the acquisition of digital skills from all kinds of people. You know, my son is very proficient in all digital media, but I also think I learned 2 things. And some of our speakers from really places that we would say are remote, and we actually have 1 speaker, I believe, from Novosibirsk. Can you imagine how impossible it would be for someone, even a great physician from Novosibirsk, to travel to San Francisco or to Warsaw or anywhere else to participate in a congress?
And to give 1 speech.
Or to give a speech, exactly. And we're absolutely delighted to have him. But one thing I learned actually last year, you know, when the new technologies come, they're usually very expensive. And it's usually a bill of $10,000 or $20,000 for a new procedure. And I remember that at our last conference, one guy from London actually showed a procedure that normally would cost $10,000, and he takes 2-3 catheters, 2-3 wires, and achieves exactly the same at 10% of the cost.
Yeah, sure.
I think, Grzegorz, we have to stop talking and move to the scientific session.
Yes.
So let me do the honors, and let's start the first session. So we have 4 great speakers. We have Professor Kobajter from Paris, who is ready to start. Then you're giving a lecture. We have Professor Dziedziuchowicz from Zielona Góra from Poland, and we actually have a cardiologist, Piotr Musiałek, and from Kraków, and Professor Helena from Gdańsk. So we actually have a cardiologist. Are you surprised that we have a cardiologist at the endovascular conference? Are you offended, Grzegorz?
You know, maybe we have to talk who you are.
Yeah, we need
vascular surgeon, cardiologist, or endovascular specialist.
Yeah, we will talk. You have my word. We'll talk. Sure. We will have 2 days. All right, let's start a session. Let's bring the first speaker in. Thank you very much, and see you at the intermission.